Hello,
Hey.
everybody. The lighting is any good? Great. Hi, Tony. Mahogany. I think there's a few more people coming.
Do you want us to turn off the video and audio?
All right, let's share that screen again. All right, so let's start with, so what you're seeing right now is the forearm. We have the epicondyles of the humerus. Yes, epicondyles of the humerus are right here. So this one right here is going to be the medial one, closer to you. So we can palpate it as we go about it. The flexor carpi radialis, we're going to explore the flexor cardi ulnaris, and the names come because they attach to that bone or to that side. Yet all flexors, and most of them are coming from the epicondyle, so the side, that's the medial side of the body. So as we look, this is medial side, this is the epicondyle on this end. And the attachments are mainly going to be on the carpals. And the other two flexors here, the flexor digitorum superficialis and the profundus, and they're called digitorum is because they attach the tendons all the way to the distal phalanges. So they attach all the way to the tips, while the other flexors here, the carpi radialis ulnaris and the palmaris longus, they attach to the either the carpals or extend a little bit to the fascia on the metacarpal. All right. So I recommend you look through this. Well, I'm going to show you the video of each one to kind of see a little closer view, having each one of those separated. Okay. So now we're going to leave this, explore those muscles and those muscles. And as you can see, I like that they have them separated because in the quiz, in the exam, they're going to ask you about the flexors that flex the fingers, while these are activated from flexing the wrist. So if you want to try to do that for a moment, you can place your hand on the epicondyle and just flex the wrist, and you should see some movement come in right here. Okay. Um, as far as it's going to be hard to resist the hand and palpate at the same time, but if you resist the palm, you can definitely see you're activating your bigger, deeper muscles. These muscles tend to be wide and flatter, while these tend to be longer. So different shape. So let me go in to the exam coach so we can watch those videos. And as we go with that, we can, if you'd like to have some flashcards, write them on a flashcard, those insertions origin, you could do that. Okay. So let's start with the flexor carpi radialis. All right, it's connected to the radius. Check out where it connects. So look at the book and see the details right there. All righty, where are we? The flexor carpi radialis.
We have an anterior view of the right forearm and hand, and we are looking at the flexor carpi radialis muscle. The flexor carpi radialis is one of three muscles in the wrist flexor group, and it is located in the superficial anterior compartment of the forearm. For context, we also have the pronator teres and palmaris longus muscles drawn in to this figure, and they are ghosted so we can see through them a bit. The flexor carpi radialis attaches proximally onto the medial epicondyle of the humerus via what is known as the common flexor belly tendon. From there, it runs distally to eventually attach onto the anterior side of the base of the second metacarpal and the base of the third metacarpal.
All right, fantastic. Now we know that the origin has lesser movement than the insertion, right? Insertion is mainly where most of the movement you're going to see. So right now, let's go ahead and palpate a little bit on your index finger, which is digit number 2 and digit number 3 on the medial side right here. Okay, try to see if you, it's going to be a little more difficult to do it, but try to see if you can palpate a little bit those muscles. Okay, so you can remember them. It's going to be hard to do it on yourself, but just for you to remember. So the carpals are going to be in the palm, of course, and on the top, right? So here attaches to the palmar side. So the index and the middle finger closer to the carpals. Can somebody read the insertion? Hi, Wei. Hi, Sophie. So this is the origin, and this is the insertion. So let's go ahead and just flex the wrist and try to place 2 fingers right on those insertions. It's a little bit lower than the carpal. So the carpals are going to be on these lines that you see on your wrist. It's going to be a little bit distal to the proximal on the palm, right there. Beautiful. Okay, so now we're going to remember that. It's a long muscle, long belly, fusiform shape with a long tendon. So the tendon kind of comes on the distal third of your forearm. So from here to here is going to be your tendon. So maybe you can see it here sticking out like a vein, and that's a little harder, but that's where that is, okay? Let's move on to the next one. The carpi, the flexor carpi, which one? Ulnaris. Let's do that. And highlight so you can remember those, because with the hands are a little bit harder to remember than the legs. Is anybody interested in watching a dissection of this? Give me a thumbs up if you want to see a cadaver.
In this video lesson,
we'll
we're
watch
going
a minute
to explore a muscle, the flexor carpi radialis, and we're looking at the anterior side of the right forearm. And for context, the elbow joint is here. This is the medial.
Summer, I don't see a video.
The wrist joint is over here.
No video. What do you see?
Just the flexor carpi radialis, just the skeleton of it, and then it has like the 4 boxes.
Oh, I think what it does every time I open something, I have to switch it.
Hello. Yes. So hello. Mm-hmm.
Okay, do you see a screen?
We have Jack, Jason, Tony,
we're going to explore a
Yeah.
muscle, flexor carpi radialis, and we're looking at the anterior
all big.
of the right forearm. And for context, elbow joint.
They're all Chinese.
Medial epicondyle.
Sophie, can you
Jack?
Your mic?
This is the thumb side.
Hold on.
This is the little finger ulnar side. The flexor carpi radialis is one of 3 muscles of the wrist flexor group, and they are the flexor carpi ulnaris, palmaris longus, and flexor carpi radialis. So let's take a look at the attachments of our flexor carpi radialis. It is said to attach to the medial epicondyle of the humerus via the common flexor tendon, or as I like to call it, the common flexor belly tendon. From there, the flexor carpi radialis crosses the elbow joint anteriorly, works its way down distally. We can see here in this cadaver, it's become tendinous right about here. It continues down and it crosses the wrist joint on the anterior and radial side, and we cannot see it, but its distal attachment is into the anterior surfaces of the bases of the second and third metacarpals, the metacarpals to the index and middle fingers. Now, there are 5 muscles that attach via the common flexor belly tendon into the medial epicondyle of the humerus, and they are the pronator teres, our featured muscle, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris, and then in the intermediate layer, the flexor digitorum superficialis. And when there is use, overuse, misuse, abuse of these muscles, very often the muscles get tight, then the tendinous tissue gets inflamed and irritated, and then we can even get irritation, inflammation of the periosteum of the medial epicondyle. This condition is medial elbow tendinopathy, also sometimes called golfer's elbow in lay terms, and medial epicondylitis, or medial epicondylosis. And our muscle, flexor carpi radialis, is one of those muscles that can be involved in this condition. I'll make another point here, and that is that it is said that it goes, as we did say, to the medial epicondyle of the humerus. But if we look at this width of this muscle, how wide it is from there to here, and we look down here and we see that now this is pronator teres here, and this is palmaris longus here, we see that our flexor carpi radialis in this cadaver gets very narrow in here, and narrower and narrower and narrower. And actually the width of it to get to the medial epicondyle of the humerus is this wide, very, very narrow. And the reason is that these wrist flexor muscles, along with pronator teres, they very often have their bellies blend into each other. And indeed, when I tried to dissect away pronator teres from flexor carpi radialis to give you a better view of it proximally, all I succeeded in doing was tearing into muscle tissue, because the bellies of these two muscles have blended here. And it was a bit of a similar circumstance over in here between flexor carpi radialis and palmaris longus. So this is actually a very nice illustration of why the common flexor tendon might be better termed the common flexor belly tendon here. So to review, we have a right side flexor carpi radialis attaching proximally to the medial epicondyle of the humerus via the common flexor belly tendon, running distally, crossing on to attach out of view here right now, the bases of metacarpals 2 and 3. In this deeper dissection of the wrist and hand, we can see the distal tendon of flexor carpi radialis crossing the wrist joint, crossing on the medial side of the thumb, and it attaches distally into the anterior side of the base of the second metacarpal, the metacarpal to the index finger, and onto the anterior side of the base of the third metacarpal, the metacarpal to the middle finger. And in case it's not visually clear here, we can just point out the attachment onto the third metacarpal by slipping the probe deep to it. So the flexor carpi radialis, distal attachments, anterior sides of the bases of the second and third metacarpals.
All right, that's pretty good, huh? You saw pretty much the anatomy for the next 3 muscles, so that is helpful. And you can see how it's fibrous area. So a common, when they say common tendon, meaning it's a bunch of different muscles that come in and attach to one point. So from there, you're going to have branches of all these tendons. And around that, you saw some white fascia, which called apernosis. And you saw some white fibrous fascia here. There's also called apernosis. Tend to be harder to stretch because it has less blood flow and because it's more fibrous. Okay, great. Let's go to the next muscle, which is the ulnaris, the flexi carpi ulnaris. we're just going to do the illustration. And then as you can see, let's go with the origin and insertion first, so you have it in your head. So the origin is the humeral head, common flexor tendon. That's what I mean. It's where all the flexors kind of attach, which is the medial epicondyle of the humerus. So the attachments is the medial epicondyle of the humerus. Now, it has two heads for this one, as you can see here in this picture. One is on the elbow, Aconian process, and one is on the epicondyle. So if you're writing your insertion origin cards, or if they're going to relate to that in the test, they're going to ask you medial epicondyle for the humeral head, okay? And for the ulnar head, it's going to be the posterior surface of the proximal two-thirds of the ulna, the medial aspect of the Aconian process. That's to be super specific, but for you to understand, Aconian process is your elbow. So one head is going to be on the elbow, while the other one is going to be on the medial epicondyle. So it's just, they have to give it to you specific, so you know specifically know where it's at, but general, it's on the elbow and the medial epicondyle. These two right there blend together. And of course, actions, it's going to be what? Flexion of the hand at the radiocarpal joint. So the wrist, it's called the radiocarpal joints. And flexion is going to be from there, and that is going to activate it. Okay, so you see this little thing happening here? You probably have it too. See if you can pull it out. So that would be it. Yeah, it's superficial, and it's just right there, and it continues. And that's the ulnaris. That's the radialis. Forgive me. That's the one we just talked about before, the radialis, because it's on the thumb side. Now the ulnaris is going to be on the pinky side. So if you flex and see like a tendon here, and if it moves, that is it. Right here on the little thumb. So flex and see if you can find that little tendon or that little strument. So let's go ahead and get a little closer on those attachments. It's a short video. Let me know if you cannot see the screen.
We have an anterior view of the right forearm and hand, and we are looking at the flexor carpi ulnaris muscle. The flexor carpi ulnaris has two heads, a humeral head and an ulnar head. The proximal attachment of the humeral head is onto the medial epicondyle of the humerus via the common flexor belly tendon. The humeral head runs distally where it is joined with the ulnar head. The proximal attachment of the ulnar head is along the proximal two-thirds of the ulna. The humeral and ulnar heads together continue running distally where they cross the wrist joint and attach onto the pisiform and the hook of the hamate and the base of the fifth metacarpal, the metacarpal of the little finger.
Awesome. So here, so you can understand when we're palpating, when they say it attaches to the shaft of the ulna, that means it's attached in every point to the bone. Where here, its tendon it's only one point, pretty small. Same thing here, it's pretty small. Here it attaches all the way to the bone. So as you, let's say you flex it a little bit, you're finding that little tendon, find the ulna bone, and then flex and kind of walk your hand a little bit down and up on the bone. So it's on the bone. So see if you can touch the bone right here. Good. Now this is the ulna, right? Palpate the bone first. Okay, now we're flicking the bone. And then from here, flex a little bit and then see if that belly would pop out or gets a little harder. So as we work on the flexors or the extensors of the hand, you realize it's long muscles, there's a lot of tendons. So we got to do a lot of cross fiber techniques today and a lot of deep thumb gliding. It's probably one of the bellies could be as big as your finger or wide as your finger. And remember, again, it attaches to one carpal and one metacarpal. Awesome. Now let's move on to the palmaris longus. So these three are going to make this group right here. Let's take it back. And let's see that muscle. This muscle is mainly apronosis, if you can see, attaches to the palm of the hand from the word palmaris. So the white fascia that we saw here in the covering is right there. When we flex the fingers, sometimes you feel like a burden or like a really hard to stretch is because of that. And only 1/3 of it is actual muscle, which is closer to the epicondyle.
We have an anterior view of the right forearm and hand, and we are looking at the palmaris longus muscle. The palmaris longus is one of three muscles in the wrist flexor group, and it is located in the superficial anterior compartment of the forearm. For context, we have the two other muscles of the wrist flexor group, the flexor carpi radialis and flexor carpi ulnaris, drawn into this figure, and they are ghosted. They are drawn with less density so that we can see through them. The palmaris longus attaches proximally onto the medial epicondyle of the humerus via what is known as the common flexor belly tendon. From there, it runs down distally, eventually attaching into the palmar aponeurosis in the palm of the hand. There are also some attachments into the flexor retinaculum, also known as the transverse carpal ligament, which is not shown in this diagram.
So it's another sort of fascia and connective tissue, okay? So let's just blend those together,
which is not
and
shown
realize
in
so common tendon, yes? Common tendon of the epicondyle right here. Now we have, if you can notice, the long tendon of the carpi radialis and the carpi ulnaris and the palmaris longus. If you would just flex or do this kind of, I don't know if you're able to do this, you will see all these tendinous. You see that? I don't know, because and so this is what we want to flex. Yeah, you're going to see these are all of these tendon flexors. Now, if you look at your page, now we're going to go to if you look at page 171 and look at the flexor digitorum and superficialis, which we're going to do next, and you can see how also from the wrist down, we have long tendons. So here you're going to see all the tendons for the flexors. Yes, a lot to work on. So let's discover those. And again, they're going to also flex. All the actions of these muscles I'm showing you is going to be flexion of the elbow. Let's go first with the superficialis. Kind of wide, has two attachments as well, and connects to the 4 digits.
We have an anterior view of the right forearm and hand, and we are looking at the flexor digitorum superficialis muscle. The flexor digitorum superficialis is located in the intermediate compartment of the anterior forearm. The flexor digitorum superficialis has two heads, a humero-ulnar head and a radial head. The humeral portion of the humero-ulnar head attaches proximally onto the medial epicondyle of the humerus via what is known as the common flexor belly tendon. The ulnar portion of the humero-ulnar head attaches proximally into the coronoid process of the ulna that we cannot see deep to the muscle belly tendon seen here. From there, the humero-ulnar head runs distally and is joined by the radial head. The radial head attaches onto the anterior surface of the proximal half of the radius and joins the humero-ulnar head, and the two heads together run distally. When the flexor digitorum superficialis gets down to the wrist region, it splits to form 4 distal tendons, one going down into the index finger, finger number 2, one going into the middle finger, finger number 3, one going into the ring finger, finger number 4, and one going into the little finger, finger number 5. Each distal tendon attaches onto the sides of the anterior surface of the middle phalanx of that finger. And in so doing, the flexor digitorum superficialis tendon to each finger splits. This allows for the deeper flexor digitorum profundus distal tendon to run through that split to eventually attach onto the distal phalanx of that finger.
All right. So here we're gonna see the width of this muscle. This joint right here is humerus, the upper bone, and the lower bone is the ulna. So this joint called humeral-ulnar joint, okay? Perfect. Let's go to the next one. And then probably by that time, our 40 minutes will be up. And then we have to log in again, everyone, okay? Sorry about that. One thing probably I want to add to this, so just let me make sure that you understand the origins and insertions. Let's see. So the humeral ulnar head, which is the common flexor that we talked about, but it connects to the medial epicondyle. So that's what you need to understand. It's just medial epicondyle. Of course, they connect to the ligament as well, but I don't think they'll be focusing on that for you as much as you understand that it's connecting to the medial epicondyle. And it's going to tell you maybe golfer's elbow syndrome or so. All right, and the radial head, that's the other attachment, is going to be proximal 1/2, just to be super specific on that. But what you're looking at is the shaft of the radius. The shaft of the radius, we talked about the shaft is the long aspect of a bone, right? That diaphysis, which is the long shaft. And they both attach to the phalanges, middle phalanges of finger 2, 3, 4, and 5. Those fingers. All right. Nerve innervations. This is kind of important if you want to help somebody with a tennis elbow or golfer's elbow, because sometimes there's irritation to the nerve. When we get to the nervous system, we'll discuss all these nerves and how they innervate. But for your knowledge, the nerve, which is the median nerve, we have the ulnar nerve, radial nerve, and median nerve, which we'll discuss, which is the plexus, nerve plexus, the brachial nerve plexus, okay? Just write C7, C8, and T1. Nerve coming from the cervical 7 and the cervical 8 and the thoracic 1. All right. So that leaves us with the flexor digitorum profundus. And if you would like a video on any of those with the cadaver, please let me know. I have my phone right here, so you can also message me if you want to message me. Okay, let's move on to the last one for this here. Profundus digitorum. All right. Okay, so while we're here, we're gonna realize this one is not as wide as the other one, but yet connects to the old digits, and it also innervates the median nerve. So you're gonna see a lot of aggravation to the median nerve with your clients. Is very common. So C8, T1, and as well ulnar nerve, C8 and T1. So it's like the other one, okay? So let's go ahead in here and watch that. This will kind of stick to your head. And
we have an anterior view of the right forearm and hand, and we are looking at the flexor digitorum profundus muscle, one of the muscles in the deep anterior compartment of the forearm. For context, we also have the brachialis and the pronator quadratus muscles drawn in, ghosted, so their density is less, so we can see through them a bit. The flexor digitorum profundus attaches proximally into the medial and anterior surfaces of the proximal half of the ulna, as well as into the interosseous membrane. From there, the flexor digitorum profundus runs distally, and when it gets to the wrist joint region, it splits to form 4 tendons, one going down into the index finger, finger number 2, one going down into the middle finger, finger number 3, one going down into the ring finger, finger number 4, and one going down into the little finger, finger number 5. Each distal tendon eventually attaches onto the anterior surface of the distal phalanx of that finger.
Awesome. How does that feel to you guys? Okay. Kind of have a good idea of the flexors at this point? Okay, I have 2 minutes and it's going to cut us off. Any quick question before we kind of log back in? Okay, then let's go ahead. I'm going to stop the video right now. If you want to get a water, and please log in again, okay? That's only for today.